My name is Abbas Bhuiya. I'm Deputy Executive Director of the International Center for Diarrheal Disease Research, Bangladesh. This is one of the unique health research institutions based in a developing world. It's mostly known for its contribution in developing oral rehydration therapy for the treatment of diarrhea. That particular intervention is labeled as the medical miracle of the 21st century, which saves millions of lives in the developing world. But even if its focus has been on diarrheal diseases, but currently its mandate has broadened to anything on health research, from highly advanced laboratory researches to applied research at the community level. I'm the Deputy Executive Director of ICDDR B. I'm second in the hierarchy of the organization since July 2010. But I worked in various capacities in the organization as a researcher and head of various units and departments in the past. I would say that Bangladesh was like any other neighboring countries, and then research in Bangladesh somehow bellowed. Perhaps because of its hosting the Cholera Research Laboratory, which was a credible research organization established in the 60s. And there has been an appetite on evidence, which has become part of the culture of Bangladesh among the bureaucracies, academics, and others. And perhaps it was because of the credible research my organization has been doing since then. Among many researches ICDDR has done so far, I think some of them are most instrumental in terms of impacting the development of the country. Notable of them are our development of a service delivery program for family planning among the population in the country. As you know, Bangladesh is a Muslim country, and its high fertility rate was a major challenge for such a small geographical areas. And that recognition was there since the 60s. But nothing much could have been done because family planning could not be made popular. When in the 70s, the world was divided into two groups. Some believed that development is the best contraceptive, meaning that a country will only embrace family planning when it becomes developed, passes a threshold level. The other group believed that that will be too long to wait for, and perhaps some countries will never achieve that, and population can never be controlled. So rather, we should innovate innovative ways of service delivery with family planning, even if it is a poor country. ICDDR is sidelined with the second thought, and it was very courageous to establish an operational research program on family planning service delivery in one of our field sites called Maternal. We started with locally recruited female workers, perhaps first of it in the country where you employ rural women for any service delivery program. And then that succeeded really. We started in 1977-78. By 82 we knew that family planning can be made popular. But there is a but, that there has to have an improvement in child survival. That was the only thing what was worrying the couples to limit their family size, without being sure that the children they gave birth to, they survive. So we complemented, side by the innovation of the service delivery, which was through frontline female worker. We had institutionalized a complementary maternal child health program, which ensured immunization of the children, diarrhea treatment, all the other competencies we have at that time. These two programs together proved by mid-80s that even in this conservative Muslim society, the family planning acceptance rate could be made very high. And then ICDDR scientists sat with the Bangladesh government and wanted to transfer this experience to government system, which we have very successfully done by establishing extension field sites where the ICDDR experience was transferred. And eventually ICDDR was involved in recruiting female health worker, family planning worker from the whole country, which is now around 30,000 in number. That's what, in my opinion, is one of the interventions and benefit of our operational research, which made Bangladesh what it is now. The real success you'll be able to mirror if you compare us with Pakistan, which was our twin sister, and we had almost the same background, same benchmark. If you see, we have done much better in terms of fertility control, which the current rate of total fertility rate is around 2. but Pakistan should much higher. So this is an evidence of applied research which can have a huge impact in national development in all sectors, and ICDDR has contributed to that. This is one. In the pure health sector, diarrhea has been a major cause of death among children in Bangladesh, almost in all age groups. Among childhood it was diarrhea, among adults it was cholera. I remember from my childhood when there used to have cholera epidemic, village after village people used to die. And you even would be in circumstances where you don't get enough alive male to bury the dead bodies. It was as bad as this. But ICDDR discovered how to manage cholera through its experiment and research based in Dhaka as well as in our field sites. And now you know that cholera patients don't die. Bangladesh still has some cholera, but the case fatality rate from cholera is near zero. That was another contribution we made. In terms of managing childhood diarrhea, which causes dehydration among children when they die of dehydration, ICDDR discovered the oral rehydration solution, which at the time was oral rehydration therapy. It's a simple solution if you see it, but the science behind was pretty complex. There has been over 20 years of very hard research, clinical research, lab involving all these people, epidemiologists, eventually came up with the solution and perfected it. Now it has become almost a medical miracle of the 21st century and has been very effective in averting child death at a young age, which also has an impact of malnutrition. But I would be failing not to mention that just by having the knowledge and solution in itself was not enough. In collaboration with BRAC, one of the largest NGOs in the world, they took the technique of making oral rehydration solution at home from locally available ingredients, and they taught every mother by visiting every household in Bangladesh to teach them in the 80s. And as an outcome, it has become a part of our culture how to manage diarrhea by using oral rehydration solution, and it itself made a huge contribution in the child survival among the children, and for cholera, with the cholera management strategies developed by us. Side by side, as a byproduct of making our family planning program successful, we had to promote immunization. And then that immunization, government knew that it's very important, but simply could not popularize it. So government has opened up space for NGOs for facilitation of immunization services, which NGOs, especially BRAC, they took up the role in the mid-80s and popularized immunization across the whole country. There are a lot of misconceptions about immunization in Bangladesh. People thought that these are not immunizations, these are basically injections to control fertility so that people don't give many births. So there is a lot of distrust and suspicions about immunization. But those facilitation programs removed those barriers. And eventually Bangladesh achieved near universal immunization coverage by 90s, from 2-3% in the mid-80s. So again, even the immunization had a lot of components in operational research, which ICDDR and BRAC worked together to develop delivery methodologies and contributed enormously in reducing deaths which are preventable from unknown diseases. The other example which comes to my mind in terms of research, that you know that now it's common to vaccinate or immunize adolescent girls with anti-tetanus vaccines, but that was not the common knowledge. It came by coincidence that the protection from tetanus toxoid is transferred to the baby through the mother. And it came from one of our research in Maternal, where immunization shot was used as a placebo among the control group. And later we analyzed the data and saw that the beneficial impact of tetanus toxoid passed up to the newborn. And tetanus was a huge major mortality, cause of mortality among the newborns. We used to call it like alga, evil spirit, all this kind of thing. And that knowledge of generated by ICDDR convinced the country and the rest of the world that even if you vaccinate adolescents before they get married with tetanus toxoid, it will protect them, and also it will protect the babies after they get married among various stars. So there are a lot of examples of research which has contributed towards the development of health in Bangladesh. And Bangladesh's health research was not for research sake. I mean, we are always trying to solve a problem we are facing, be it diarrhea, be it family planning, be it immunization, and we try to sort it out, find a solution for those. And Bangladesh government has always been supportive. If you go to dissemination seminars in Bangladesh, like demographic health surveys and other things, or any other research findings, you'll be very impressed by seeing the openness of the audience, especially the government machineries, the officers, to take the research very seriously and take a message home so that they can influence their policies and programs. I don't think you will get this kind of openness to evidence other similar countries in the world. And a lot of it was possible because of a couple of organizations in the country which created credible evidence where people see value in them and eventually made them open to evidences. So we don't have confrontation between policymakers and the evidence. Even if the findings quite often doesn't support the efficacy of the government programs, and they take cautiously and try to improve upon. So I would say in the Bangladesh's progress towards health achievements, culture of research and openness to evidences contributed enormously in shaping our policies and programs, which made Bangladesh different. And perhaps we got rid of the level that we are a basket case. We believe we'll never be. I think the commentary on entitled Health Progress and Research Culture in Bangladesh, I will give you more specifics in terms of how research has contributed. In my opinion, that was also a briefer version because Lancet had serious word limitations and citations one can make. But the whole series will provide enough insight for readers to see how research has contributed towards the health progress Bangladesh has made. I thought one of the reasons is that it's clear that we have limited resources. We don't have the luxury to waste resources, be it program and policies and services. So we cannot afford to take a risk on making our services as effective as possible with as low cost as possible. And to get out of this, only way is to prepare yourself to do research, get all the intelligence information before you go in scale. And I think Bangladesh was very wise, and that recognition came out of our level of economic development and dependence on external resources. So we had no option but to depend on research and intelligence information in that sense to make our policies and programs as informed as possible. And I wanted to reiterate the important role research played in the development of Bangladesh, specifically health. And in the context, I must mention the name of International Center for Diarrheal Disease Research Bangladesh, which existed there, and the support it enjoyed from many development partners, including DFID, Canadian CIDA, Swedish CIDA, OSAID, and Bangladesh government, which made it possible to make the opportunities of the existing organizations for the betterment of the country and improvement of health. If it wouldn't have existed, I don't know how else this purpose could have been served. Creating an organization of this kind, in my opinion, would be necessary, but it would be very time consuming. The benefit would have been postponed for very long in the future.